Good afternoon, everyone. Welcome to the Eastern Shore DDA Community Listening Session. We're so glad that you've joined us today. Just some housekeeping for those that are in the room. The restrooms are out the door and to the right. If anyone needs to use the restroom, but we are glad that you were able to join us today. On Monday, October 6, 2025, the DDA operated Medicaid waiver amendment for community pathways began. The DDA has developed a dedicated web page titled 2025 Waiver Changes and You, which you can find featured on the DDA's homepage. This dedicated page includes guidance and links to recent webinars on the amendment. In addition, a waiver change in addition, a waiver changes and you frequently asked questions document has been added to address some of the questions that the questions DDA has, or that you might have for DDA. A couple of housekeeping tips, and thank you for those of you who are in person. We also have our online audience as well. You can click here for closed caption. Next slide. Mics and cameras, another housekeeping tip, mics and cameras are currently turned off. However, once you raise your hand, you'll be able to use your mic and your camera will be turned on for our online audience. You can click at the top to post a comment. And the yellow arrow is also pointing. You can click right there to raise your hand and share your comment aloud. This is a slide that I never read the whole thing, but we're all here to get information, to share information, to give comments to the DDA. So we know that we will respect all viewpoints and value all viewpoints of everyone here. So we know uncivil like behavior, disruptive actions won't even be a thing for us to have anyone removed from the meeting. As a result, next slide, please. We're going to have some group norms. We want to hear what everyone has to say, our online audience and our in-person audience. So we're going to ask that one person speaks at a time. We're going to ask for comments, please. We want to hear everyone's comments. So we're going to ask you to limit your comments to 3 minutes. And of course, we know in order to hear, we have to listen with respect and avoid interrupting others. So welcome again to the Eastern Shore listening session. We are actually very, very glad that you're here to share information with us today. As way of introductions, I would like to introduce to my left, Deputy Secretary Marlena R. Hutchinson, Chief Operating Officer Robert White, Chief of Staff for DDA Allison Wool, and our Eastern Shore Regional Director Rachel White. Thank you all very much. So again, we welcome you. What we're going to ask is comments. I will be taking comments from the audience as well as comments from everyone online. Remember, once you raise your hand, your computer will be opened up so we can see you and you will be able to share your comment. Right? So we want to hear comments from you. We are so glad that you're here. So our first question for the audience, online and in person, is what is working well? What is working well with DDA? You want me to do right? I don't know.
outreach um, and the willingness to try to improve. And from my perspective, the dedication of the staff.
Thank you. Would you mind sharing your name?
Steve Canstrom,
Thank you.
you're welcome.
There's another hand. Thank you for speaking up so that everyone online can hear you as well.
Good afternoon.
Good afternoon.
What's working well is for my family. I like all of the communication that's been coming out from the DDA board as far as all of the changes that took place and trying to understand um, how it's going to affect, you know, families. So I appreciate the different, um, the webinars and how you can go back and see the webinars. So I appreciate that. And I appreciate you being here today. I appreciate you being here today to listen.
Thank you so
So
much.
thank you.
You're
Oh,
welcome.
my name is Karina Jones.
Thank you. Do we have anyone online?
Yeah. Good afternoon, everybody.
Good afternoon.
My name is Elizabeth from Impeccable Healthcare. Working well with individual is respecting their rights and honor their dignity.
Thank you so much. Do we have another one? Next question. While you all are thinking, we also, once we go through the four comments, questions that we would like comments on, we're going to come back and circle back if you think of something you want to add. Our second question that we would like your comments on: what steps can the DDA take to make its programs and services easier for people to access and navigate?
How you doing? Cody Stevens. One of the things I think would be definitely beneficial for us would be the same education that seems to be coming to a lot of the care providers, to a lot of the team, for lack of a better word, for our participants. If some of that similar education could travel down to the families and some of their direct caregivers, there seems to be a disconnect between a lot of the team members and the family of staff as well.
Thank you. What steps can the DDA take to make its programs and service easier for people to assess and navigate?
I'm sorry, I might be talking all day. I'm sorry. Um, Karina Jones again. When you when the art when we were with the art,
Mhm.
we had you could call the art if you had an issue, and we had direct numbers to Peggy Swift, Karen Bradbury. We all had their extensions. Now with Fellow, we can't. We can't do that. So you're asking um, easier to access and navigate. I know we're putting in tickets, and it takes a very long time to get those Zen tickets answered. And then when the answer still doesn't come, they'll close it, and then you have to reiterate the issue. So to make it easier, let's go back in the day where we had accessibility that instead of calling the regional office. Um, Poor Jonna, she probably get mad with me. But this go back in the day where you could talk to the regional offices, but we need to have extensions, key players that we can talk to, not just putting in a Zen ticket and not being answered. So I think navigating the program now that we're all consolidated, all three, I think navigating each program by having extension not only for fellow, but for GTI and for PPL. That would be accessibility with the participant and the family that's helping. So
Thank you.
Not make any changes to the current program. Like whatever changes DDA and fellow is working with, just keep everything the same and not make any changes.
Thank you so much. Christy Russell online.
Hi, yes, thank you. Christy Russell. I'm from the Eastern Shore, and I homeschool my son, and we are in the transition age. We are left as homeschoolers without any sort of transition guidance and how to apply for DDA. We have nobody that helps us walk through that process, and we're kind of left to navigate the whole application process independently and rely on our regional offices to make sure that we're getting the paperwork in on time and that we have all of the requirements together. So I would say, especially because there is a rise in the number of families who have children with disabilities who are choosing to homeschool their families, that there is specific outreach to make sure that families who are homeschooling also have access to similar resources that children who are in the transition process in the public school system have.
Thank you, Christy. We have another online.
Hi, good afternoon, Ivy McIntyre. I would echo that in the public schools as well. I do find that there is a gap there when children are exiting the school system, like she said, with the homeschool, where people are not getting enough information about how to access and navigate the process, and it can be complicated. The different systems, all the different systems they have to go through are very complicated, and I think a better partnership between DDA and the local school systems, the local special education departments would be very helpful.
Thank you so much. Going to go to the next. Oh, go ahead.
Sorry. Hi,
No,
my
go
name is
ahead.
Jennifer Ricketts. I'm with the Dorchester County Health Department. Definitely echoing what Ivy said, a stronger connection with the school systems, especially for the transition youth age group, but also kind of on a simpler sense, the initial application for eligibility can be a hindrance for people, maybe making that more online accessible versus now. I know you can fill it out online, but you have to print it and send it in. So we do try to facilitate that at our health department in submitting it for people. But if maybe they could just submit everything online or update the application itself, maybe have a clearer checklist of what people need to submit with it for to document eligibility. Just a small, change that might make a difference.
Thank you, Jennifer.
No problem.
Yes, sir. In the back, and then I'll.
My name's Paul Jackson. Just on the basic levels of the access nav here on the Eastern Shore, there is still a lot of people that don't have access to high-speed internet. I know just on at my end, we just got it here not long ago. So, and a lot of the things that they're requiring you to do is requiring high-speed internet, or at least have internet access. And there's a lot of people, especially on the lower Eastern Shore, that just doesn't have that ability at this time. So just ways to be able to maybe help navigate through that process, because if you in this day and age, if you don't have the high speed internet, you ain't connected to nobody hardly. And it's hard for parents to try to deal with that and try to meet all the requirements that are becoming required of them. Thank you.
Thank you so much. We heard that also in Western Maryland as well. So thank you for that comment. We had one up here, sir.
Cody Stevens again. I don't mean to double dip. um, kind of thinking about it along, one of the things that we could potentially do, because there seems to be, there's always kind of been a disconnect between the Western Shore and Eastern Shore regarding information, resources, even when it comes to the news. So the theory would be to have something literally sitting on this side. I do understand we have a regional location. Um, I'm in the process of creating a nonprofit dedicated to filling that gap, giving the information in, teaching education, to be able to fill out these applications, to be able to go through CPR, first aid, MANT training, have those certifications through us. I would encourage if we could find other nonprofits like this to continue to team up with, educate those nonprofits, and essentially teach the staff, to be able to teach the families what's going on. Because to echo what I was saying previously, there does seem to be that disconnect between the families and their teams. As things are changing, the teams are still learning, the families have no clue. It adds to a lot of frustration, confusion, and then eventually lack of resources to a lack of budget.
Thank you. Next question. Right. We want to hear from you. What actions can DDA take to strengthen and rebuild trust in the community? Online and in person, what actions can DDA take to strengthen and rebuild trust in the community? Comments?
Good afternoon, Bill Ford.
Thank you. Good afternoon, Bill.
One of the things that seems to be experiencing is the difficulty in getting services justified for the clients. They've been determined to be disabled, and from what I understand, the self-directed plan is to improve the independence of the person. When they're asking for services to enhance their independence, it seems that you have to justify it in triplicate. And then the next year, justify it again and again, and to find ways to shortcut, shortchange, or to eliminate the services. If I'm wrong, please tell me. But with my son as a client, he's been in the self-directed program for a couple of years, and it seems like every year services we have to justify and or getting eliminated.
Thank you.
Hi, Michelle Gregory. I'm from Salisbury. Just for full disclosure, I am a sitting city council member in the city of Salisbury, and I'm also the parent of a participant and a family provider. I think to dovetail off of this, I think just a very simple matter of rebuilding trust within the community and participants, particularly in self-directed, I think it would be to trust the families that are providing that care, because it is felt very targeted, especially in the self-directed program. Families as providers have felt very targeted, as if they are the enemy of their own children or family members who they are providing care for. Oftentimes, we are the best possible providers. We know these folks inside and out. I know my son inside and out and what he needs. And the lack of trust in what we know about our family members seems to be pervasive. And we often feel like we are being treated as the enemy, as someone who is not looking out for the best interest of the individual that we are providing care for. So I think this is a not necessarily a policy, but an attitude issue And, it is something that I have experienced. It is something that friends have experienced in with their family members, where they feel that they are targeted. Number one, they feel the self-direction is specifically being targeted.
Mhm.
And number two, they feel that they are being told that they are not the best judge of what is necessary for this individual. Like the gentleman just said, we have to constantly have to justify things. My son has been a participant since January of 2018. I have been doing this a very long time. I have raised him. He is 31 years old. So I have been doing this for a very long time. I know better than anybody what he needs when he needs it. And having to constantly justify those needs is frustrating, to say the least. And that's the gentlest way I can say it.
Thank you so much.
Michelle, I hear you. I want to piggyback off of Michelle and you as well. That is so true. It's just the bottom line. Family and staff is the best. We know who we want around our children, and we know that we have faith in them because my child's 27. I've been doing it since 2016, and I wouldn't trust my child to a provider. I am sorry. My child is my eyes, my ears, my heart. He's everything. And because of having family as staff taking care of him, he's alive today. He's flourishing. He's doing well. So we do feel like we're being beat up. Yes. And I know DSP shortages all through the provider, um, through the providers, they have shortage through DSP. But when you have family and staff, self-direction do not have that issue because we're going to put the best people in our homes for our children. They,
Ms. Jones, Ms. Jones, if you can define the acronym that you said, that would be helpful, please. We want to make sure that
for
the,
DSP, direct service provider. dir-
but
Oh, I'm so sorry,
yes,
director. I'm so sorry. Direct service provider. Yes.
thank you.
Uh-huh. Thank you.
We're going to go to the next question, but I would like to share with everyone that this is the fifth, I think, um, fourth listening session that we have done. And the information is being recorded. It will be collated, put together um, for change, and hopefully will inform the um, external work plan of DDA. So with your comments, the DDA is listening, and it will be looked at, analyzed, and used for the external work plan. So I did want to let you know that. Okay. Jessica,
Hi, can you hear me?
Jessica,
Hello?
yes, we can hear you.
Oh, okay. Thank you. My name's Jess Gallatin. I'm joining online. I just wanted to kind of ask you guys a question really quick to see if you guys were monitoring the question or chat box on this, and if you're able to read any of our questions that get sent through there. I sent one or two a few minutes ago. One for the program accessibility. I was wondering my comment was DDA should work diligently to provide access to my LTSS for participants. Participants having access to their own information is paramount. So I just wanted to add that comment on there. I'm not sure how far off the DDA is from being able to launch or provide that, but I think that would eliminate a lot of confusion when families and participants are able to see when things get sent, if they were sent, where dates are for renewal. All of the important pertinent information seems to be like held up and gatekept by CCSs that constantly change. So it's very, very hard to keep up with and monitor. And there is a system that's already available that houses all of that. So we're like so ahead of the game. We just need access to it. And I do think that a lot of people worked really, really hard in advocating for that access to the extent that they tried to make it law. So we're all kind of just wondering when that's going to roll out and why it hasn't.
Thank you, Jessica. And your questions are being recorded that are put in the chat. Got another question online? All right, thank you. Christy, your comment?
I'm so sorry. I must have accidentally raised my hand. I don't have a comment for this one.
Thank you. We had a hand.
And thank you. You're going to review it, analyze it, but then at some point, I would think we'd get some feedback after that. Not just you all go away, you hear, and nothing ever gets resolved, or we never really hear, okay, we heard what you said about, our feelings, the families feeling targeted, feeling threatened, from the administration. And not that you can have a direct answer to that, I understand that, but at some point, something that gives us a feeling that you are listening and you hear us, not just you're going to go back and you're going to analyze, you're going to review. I just, I'd like to see something more. And also, and before I go in and I'll see the other questions, does EDD fall under you all? I mean, is that something that we can, address here? Eligibility determination to. So Mike, any comments on that? That doesn't belong here. And my comment with them is they need to improve their communication. My Lord. Are they state employees? They are? I have never seen any where a state employee, meaning my CCS, tries to communicate, just, ask them a question on our behalf, and they don't respond. It's unbelievable to me. I mean, I can understand the excuse of not responding maybe to me. I don't, I certainly wouldn't contact them directly. But my CCS, who's a fellow state employee, that you don't even respond to critical questions when it's their fault we lost our redetermination. It's just as a taxpayer, it is just is absurd, and that's the best word I can come from it. So that's
Your name, please.
Jackie Davis.
Thank you.
Thanks.
That's our hand. Sadea Corbin. And please forgive me if I mispronounce your name. DDA has heard that the amount of information being shared can sometimes feel overwhelming. What are more effective ways we could share information so that it's clear, concise, and easier to digest? D-
Because the manual is always changing,
mhm.
right? Okay. I don't know how many papers I don't printed out. So, as a gift to all of the participants, Western Shore, Eastern Shore, Southern Maryland, everybody, can you, National Harbor, that's right. Can you send out an updated manual? I'm telling you, I don't, I mean, FedEx love me because I keep printing, but it changes. And that's fine, that's fine. But can you send out a manual to all of the participant? Can we request that? No. I mean, because it keeps changing. And I think and put it in plain language for Spanish, for, different languages. But I think it will make it easier. And I know that you can go online on the DDA website and look at it, but I'm old school. I gotta have a book. I gotta read it, and that's why I keep printing. So that is my suggestion, and thank God for my CCS. Oh my God, she puts up with me. She's awesome. But if we can just put a manual as a gift to all of the participants, this is what's happening, plain language, Karina Jones will be happy.
Ms. Jones will also add that comment about your CCS to the what's going well. Sir.
Sorry again, and I honestly do not mean to monopolize, but as the young lady here is stating, clear and concise English, constantly changing, can we create a manual that only changes once a year? When the fiscal year changes, the updates change. Number two, make sure that the CCSs and the brokers are on point with the upcoming changes prior to them going into effect. Don't come across on June 30th and say, oopsies, July 1, we know we're supposed to change, but all of a sudden now we've got 325 paragraphs that are now going to be reworded. And again, eliminate the double talk.
Thank you.
Yes, Paul Jackson. As far as the clear and concise things, it's like for those of us who have guardianship over our children. Now, and I haven't seen where there's this document that's coming out for substituted judgment. So, as far as I know, that hasn't been put out yet. I mean, you can correct me if I'm wrong, but if we have to go to a lawyer to see what rights might be taken from our son and the rights that's been given to us as a parent to make said decisions, because we go through the courts to get this done, and we have to go through a lot to get that done. And if if you're going to wait until April 1st, some of us have new plan years coming into effect, and it takes a while to get things done when you have to go through the courts. And to be waiting that long, so this is supposedly going into effect on October 6th, but yet that form is still not available that I know of. So how do we know what we're being told we have to sign or agree to when we can't even see the form to make those decisions? I mean, it's very frustrating when you get forms thrown at you with a very limited amount of time to make decisions that affect a lot of things. That's, thank you.
Thank you.
I think because everybody's kind of touched on the same topic. I think what I'm hearing from folks here is that we need to slow down. There are too many changes happening too quickly with too little timelines for people to be able to absorb and understand and those sort of things. I think we've seen an absurd amount of changes in the program in the last 2 years, 3 years. And I understand some of that comes from the federal government and all of that. But a lot of that came down to the state not getting its act together and getting it done in a timely manner so that we had time to react. You know, when EVV came around, that became a problem because there are a lot of folks that needed the technology and the language to be able to understand it. And I heard from folks who were elderly, who did not understand how to use the technology and that sort of thing. So I think what I'm hearing from everybody here is that there are too many changes happening too fast and not in a orderly manner. It just seems like it gets dropped on us. We have a very short time to react to it, and then the next change happens. So I really love the idea of like changes happening once a year on a schedule, and make sure, I think, also because all of our timelines are on different, we all have renewals at different times of the year and things like that. Ours was October 5th, and those changes happened on the 6th. So like, I mean, there's there are timeline issues, I think, all in all, with all of these different changes and adjustments, and it's very difficult when to get your footing when that's all happening at once.
Thank you.
Yeah, I'll kind of piggyback as well. One of the things I noticed with the manual, and I understand there's a lot of changes that have gone on in the past years, and sometimes it's hard to keep up. I can respect that. However, one of the things that we continued to go through this year is every time there was a new manual, we had to go find it. We had to go search the website and track it down, and it wasn't always easy to do. We didn't know when it was going to come out, and we didn't have any idea what it was going to look like. So if the idea could potentially be to, every time there is a new manual, to have it sent out. We have contacts for everybody, let's send them out. That way there's nobody searching, there's no questions. The other side would be, in the same way that we're doing these regional listening sessions, as there's changes, especially the significant ones, we understand the community pathways waiver, how that connected to CMS. A lot of people, layman's terms, are not going to understand a lot of what's going into that, what that takes, what that involves. So maybe regional seminars, education, things like that we could go into. Another thing that I wanted to point out, and it's just an example, there's a friend of mine who their child is up for renewal in May. And the way that it sounds is they got their stuff done in May, it got approved, everything's well and good. There was a slight revision that they were trying to figure out regarding some hours. When they came back, not only were those hours denied, but there was a laundry list of things that basically explained, I don't know how your budget got approved back in May. The response was because all of these changes had happened between May and October. Now that family is scared to death that they're going to lose their entire budget because what got approved in May is now not going to get approved in October.
Thank
Thank you.
you. A comment online. Jessica?
Hi, is my mic unmuted?
Yes.
Hi. So with regards to, sorry, my name's Jess Gallatin again. And so to respond to this question, the communication and information sharing. I've got a couple points. And number one, I was wondering if and when the DDA would be available to do more of like a Q&A type session where it's interactive and it's back and forth. I definitely think we've come a long way with allowing people to speak and having these listening sessions. But I think what might be even more beneficial is to have people from the top available to answer clear-cut questions. So to do a back and forth. All of us can kind of, make some comments on some of these things now, but it would be nice to get some answers. And I'm not sure if the DDA is prepared for that, but that would probably bring a lot of clarity to a lot of people. And if they have the ability to just come up and ask, I'm not saying all day, every day, you guys are very busy, but similar to like these sessions, a Q&A might be nice. And then second, because this is a number one question of mine, I don't know if DDA can make any comments or maybe it gets people thinking, but I was wondering when we're going to start having conversations, since we have proclaimed that we're a technology first state, when we're going to start leveraging technology at the administrative level. So when are people going to start being introduced to AI and technology that could absolutely expedite a lot of these things that are trying to be worked out? For example, the self-direction manual. Um, there is so much that could be done, and it's going to outpace anybody that is a human being physically working. And so, if we're not leveraging that now and getting our people and participants and families prepared on how to interact with AI, we are already behind the game. So, I had questions for DDA about whether there's positions dedicated for that. Does anyone at the regional offices know about that? Are we working on training components that are beyond just webinars? Now we have interactive avatars. There are Q&As that are AI driven that families could go to and have their questions asked. Same thing with CCSs. So then we have uniformity in information sharing. So I'm not sure if that was really a comment, more of a question. I don't know if it'll go
Thank you,
answered,
Jessica.
unanswered.
Thank you, Jessica.
Mhm.
We had Mary Beth.
Hi, yes. So I wanted to point out, going back to, I think it was Karina who was talking about the simple, clear, concise documents and things like that. I would like to remind the DDA and the MDH and all of the FMCSs that all documents that are created are supposed to be written at a 5th grade reading level. And I have tossed a couple of those into just general Google type searches to see if they qualify at a 5th grade reading level, and many of them do not. They come out higher than a 5th grade reading level. So I would encourage the MDH, DDA, and the FMCSs to go back and review their documents and make sure that they are in compliance with their contract with the state to provide documents that are at a 5th grade reading level. As well as in alternate formats with different languages, because again, that is part of the contract with the state. And those are
Mary
also
Beth.
not available.
Mary Beth, it's,
Yes.
can you define plain language?
I cannot, but I can tell you that in the contract, it states that all documents have to be at a 5th grade reading level. So if a 5th grader could read it and understand it, then I would consider that to be plain language. But again, I didn't write the documents. I didn't write the requirements. So I
You
can only
shared a
go by
couple
what
of
it says.
acronyms. Would you mind?
Sure. So MDH is Maryland Department of Health, which is what the DDA, Departmental of Disabilities Administrations, or yeah,
Yes. Mhm.
they come under the Maryland Department of Health, and the FMCSs are the Fiscal Management and Counseling Services. They also come under the DDA, the Developmental Disabilities Administration, and the FMCSs act as the HR, payroll, budget monitors for the participants.
Thank you so much. Karen Smith.
Hi, I just want to make note that with the new waiver going into effect October 6th, the clear and concise and easier to digest communication shared within that waiver needs to be shared with the FMCS. It was very overwhelming when we reached out to the FMCS and they had no communication with DDA on how to implement, how to pay directly to vendors and to IFDGS, leaving a lot of participants not with services at that time, and still continued not having their services that are approved in their budget and plan. So
Karen, can you just back up a little bit and go over your acronyms? We just always have trying to be mindful that everyone might not know the acronyms that you're discussing.
the FMCS, the financial management companies like Fellow, GTI, PPL. So yes, communication with DDA and those
DGF.
FMCSs
Mhm.
would be very helpful in implementing a waiver and before the implementation, actually have communication on how to implement it before it's present.
Karen, IFDGS.
Oh, individual family goods and services.
Thank you.
Mhm.
Jacqueline Golden.
Yes, you mentioned that what does accessible language or plain language means. We're forgetting that there are people with developmental disabilities that are making decisions. Can they understand anything that you've put out? If they can't, then no, you failed at the job. Basically, you have to show them in ways that they can really understand through pictures, simple language, skits, whatever. You're leaving them out. That's unbelievable. These are the population you're served. That's all I have to say. Thank you.
As DDA continues to focus on accessibility, quality, and long-term sustainability, what solution-oriented ideas or recommendations would you suggest for us to consider?
Blurred out. Can you,
For service delivery.
for service delivery, okay.
For,
Okay.
Yes, we got an email just the other night. We've noticed that here on the Eastern Shore, it's different than the Western Shore, just because everything's further away. It's further for us to travel to doctor's appointments. Like with, say, my son is a big sports fan. Okay, so he loves watching sports. So we were, and I've watched quite a few of the webinars, but I'm not saying I've seen them all, so I could be wrong. But the mileage is capped at $200 or 200 miles a day. So for a lot of the people on the Eastern Shore, if we want to take our individual up to, say, a Ravens game or say a Washington Commanders game, that mileage cap leaves them out. Now, I get it. You can't say necessarily do it all the time, but if it could be allowed where you say, and I'm just throwing off the top of my head, maybe a half a dozen times in the course of your fiscal year, that you can allow these individuals to be able to travel to these spots. Because like I say, for us here on the Eastern Shore, to get to any of that stuff, it's a ride. And even to doctor's appointment. Now I know it says doctor appointments have to be approved through the DDA. I get that, but sometimes you have doctor's appointments that come up pretty fast, and you're not going to get it approved in time when you may have to go. Emergencies come up, so I just think that's a way to, for like you say here on the Eastern Shore, that if there's ways that you could make some room for being able to them to be able to have exceptions to that. And I say, I get everything costs money. I get it. But for a lot of the individuals, like I say, it's a long trip up to the Western Shore. Or even if you want to go out to Western Maryland, there's a lot of things out there. National Park out there. The kids, I try to get my son outside to enjoy the outside and not just be inside all the time. So just little things like that makes a big difference and goes a long ways. Thank you.
thank you.
On the service delivery, this is what I'm getting confused. Well, there's two things, and they don't take much to confuse me. Okay. Units versus hours. So you may have You may have, okay, I'm gonna take my budget. You may have $12,000 in that line, budget line. But then you look and see the cap that says units. When did we start doing units? I mean, as long as I've been in South Direction, that was never an issue. Now they're saying, no, your employee doesn't get paid because units, you're capped at units versus hours. We didn't hear that stuff until GTI came into play. So where is all that money sitting at? Where is that money going? So to me, I don't understand that. I really don't understand that. Not when your budget was approved for the whole year and then boom, you don't have any more units instead of the hours. So it doesn't matter what you have on that budget line. The other thing I don't understand, you talk about service delivery, is the nursing shortage. My son's in REM, who, and I know it's not maybe DDA's fault, but they cannot fill the hours. So because of that, REM, rare expensive medical services, because of that, um, you cannot get a behavior and you cannot get, am I going off the record? Oh, okay, because you're asking about service delivery. So I was talking about the units and hours, and if you're in REM, you can't get a behavior plan and you can't get a document plan because they're not DDA nursing. And that I don't understand because the board of nursing in my little mind is thinking all nurses got to go through the board of nursing.
Thank you. As we've listened to different ones, it also sounds as if acronyms would be helpful, explanation of different
Yes.
terms. Okay, thank you. You have someone on the line? Elizabeth?
Yes, ma'am. Thank you so much. My suggestion at this point, though I don't have any services under the DDA yet, but I'm a medical waiver under the RSA, which I'm still navigating. Can you please put it in your plan to be having orientation for the prospective provider? I think that one also will eliminate some stress when they were serving the individual or the community. And then number two, the accessibility for the organizer or the program coordinator under the DDA. Sometimes we are trying to call to make some verification about the services for the seniors also in the community, but we could not be able to reach out to them. So my question one, suggestion one is please, we need orientation. For instance, if you want to put in for the RSC under the Residential Services Agency, you must attend the orientation. Likewise, the assisted living. So that one we, establish some ideas in the people's hearts before they jump into what they want to do. So it will also help the provider, it will help the staff, it will help also the client or the individual that we are serving. So my suggestion is please put it in the plan to have a pre-provider orientation before you launch people into the service.
Thank you. Jessica?
Hi, thank you. I appreciate being able to jump in and provide some comments a couple of times this session. This is nice. Um, I was going to suggest maybe that DDA consider some impact studies because with all of these changes happening and how they've been rolled out, obviously there's going to be growing pains, but for some people and in some circumstances, this is significant. And if it's not already in the works to be tracked, it should be, because you don't want people to get hurt. So that should always be on the administration's mind as these things roll out. And an impact study is a really way to kind of navigate that. Plus, we're building a track record historically. So we don't want to be like, hey, we all remember the COVID pandemic and what happened and what was great and what didn't work. I don't want these 2 years to be something that's like, hey, we lost participants because these rollouts were sloppy. So impact studies, I think, could really be helpful. I also feel like for long-term sustainability, there has to be a deep dive look at our rate methodology. And I don't hear it talked about enough with the RRAG group, but it absolutely needs to be talked about. It's the elephant in the room for a lot of us just observing. So I think DDA needs to acknowledge that. And so back again to some Q&A sessions, that might prompt a little bit more of a deep dive thinking. And I would love to see DDA elevate to a level of sophistication that they have this stuff, and that will automatically build trust amongst our families.
Thank you, Jessica R. Rag. Wasn't sure if everybody- Rate Review Advisory Group. I just wanted to make sure that both online and in person got it.
So just to touch on the accessibility and equity components, I think it would be good to have, our area is pretty under-resourced and a relatively poor area. So the issue that I see with accessibility and equity is some individuals have the resources, for example, to get diagnostic testing to prove their initial eligibility, and some don't. And that's something that I think might be a good way to make it a more equitable access to the system if DDA could come up with something to support that initial diagnostic component. Because for me, that is what I see as the great determinant of access.
Thank you. He's up front.
Thank you. If I haven't said it yet, guys, I do appreciate you guys being here. It is important to show that gratitude. I do appreciate it. This was mentioned in a previous question, and it might be connected to the accessibility portion of things here. It was previously suggested that there could potentially be an opportunity for the DDA to have a representative that could talk directly to families or to participants from the inside, kind of looking outward. There could be a double positive to that. For one, the DDA representative is going to be knowledgeable of all the changes, when it's going to take place, how it's going to look, and what we're supposed to do with it. On the other side of it, that representation can also know the personal side of the family. We know, especially with developmental disabilities involving the brain's an amazing thing, which means each patient is different. Every participant is different, which means there's going to be different needs, different requirements, different accessibility limits. With that, to have a representative within the DDA that can understand that story to that family, be a liaison to the DDA during decision making, meanwhile be very knowledgeable of what the DDA is working on and what they're trying to adjust and change for the benefit of everybody. I see a double positive in that. Maybe that's something we could entertain, and that could potentially help not just the team, but and not eliminate the middleman, because we obviously need the middleman. We need the team, right? But this could be a backup and support for knowledge and education for everybody.
Can someone on the panel please explain how, when a budget is approved and a couple months later, funding is withdrawn or the services are denied? How can that be when initially you did have approval?
Thank you so much for your question. Because today we're taking comments and feedback, it will be recorded and addressed.
So I'm not going to get an answer today.
For those who may have just come online, who may have missed, we're going to go back through the first question. Some of you may have thought of something you would like to comment on. What is working well with DDA? I heard Ms. Jones say her CCS. Yes. Thank you.
I'm sorry about that. So I just want to make a comment and shout out Dorchester County Health Department. Their CCSs are top notch. I have been so impressed with their thoroughness. And every time I have a question, be it a phone call, an email, responses are quick and thorough. And I cannot speak more highly of them. They are great. And I would like that on the record then.
Thank you so much. And I would agree. I realize I did not introduce myself. I'm Marlo Lemon with Co-Deputy Director at the Parents Place of Maryland. My CCS is great as well. Yes, coordinators of community service.
Yes, and I would just like to say, and again, thank you to everybody being here listening. As you can tell, there's a lot of frustration on our end. I'm sure you have heard plenty. Our CCS, again, like the lady just said, we here in Dorchester County, we've gone through a couple of them, but each ones we've had have been very good, and they do get back to us because it's important to get answers back, especially when you're waiting on such stuff, and also to our support brokers.
Mm-hmm.
We could not even function without them, a lot of us, because a lot of us does not understand the ins and out of the state process. I mean, it is just so overwhelming when you're not used to being into this stuff. So the support brokers really play a very key role in helping us get things filled out and getting services. Thank you.
Jessica online.
Hi, thanks. I just wanted to kind of put a comment out here. I would say that I know that I have definitely appreciated the monthly DDA correspondence that comes out. For a period of time there, it was a little bit stagnant and we didn't know what was going on. And it's been pretty consistent. And to add to that, it has been really nice to see pictures in those. I know particularly this last month came out, and my sister, who is a participant, enjoyed seeing pictures of, I think it was Marlena and Robert. They were both smiling, and maybe getting a vaccine or something. She enjoyed seeing some of those pictures. So that has been pretty consistent, and that communication coming out is nice, because when it didn't come out for months at a time, it was like, oh, where did you go? Just wanted to say that.
Thank you.
I'm from Salisbury, Maryland, and my CCS is with Mars, which is community service, and she is just awesome. I want to just piggyback. Marlena Hutchinson, we were in a meeting during the summer, and we talked about that DDA, the connection, and she had asked the same question: how can we get more information out? And I want to tell you, thank you. Those pictures that last month, the newsletters that's been coming, it's beautiful. I wish it was more on the shore, but I can see that you held up. You did exactly what you were going to say, and you did it. So thank you for that.
Thank you. What is your name? I want to make sure we captured it.
Karina Jones.
Thank you. Any additional comments on this one? What steps can a DDA take to make its programs and services easier for people to access and navigate? It's a question. Ian.
I would like to also say that my CCS worker, Jennifer Rodriguez, she's been very, very helpful. And I have a new support broker. Her name is Tiffany Pitts, and she's awesome as well. So I just want to put that out there because you give people thanks for helping you. I do anyway. So I just wanted to say that.
Thank you. Thank you. Jessica?
Hi, thank you. So for this question, it's kind of a little bit of a question to DDA. Maybe they can answer it, maybe they can't now, but for accessibility, I was wondering if there were routes or methods other than through online anything. So are there physical locations and are they accessible for our participants and families to come if they have questions or concerns? Having to go to a platform like the internet or their email, that's difficult. And I know that there are phone lines accessible, but for true accessibility and the nonverbal community, like my sister, she would have no way of reaching out to any of you guys. And so to come in person to try and demonstrate a question or a concern, it has to be physically in person. So I'm wondering if there are buildings like that that are accessible.
Thank you. Your comment will be recorded. What actions can DDA take to strengthen and rebuild trust in the community? Jessica, you wanted to comment on this one? Did we lose
Sorry, I was
Jessica?
waiting for someone else to go. I wasn't sure if someone else was going to ask. Because I don't want to be talking too much. I had a lot to kind of point on this. I feel like you build trust when there's some transparency. So I feel like there are many ways to accomplish that. It doesn't have to be full blown transparency. Nobody wants to watch everybody do their full-time jobs all day, every day. But I think that we could work a lot more on transparency about where DDA's mindset is and how they're handling situations. Are they taking a look at things that are going to be rolling down the hill in the future from the federal level? Do we have pieces of legislation that are coming through? So families are kind of learning how to observe that now and follow some of those things now. But I feel like transparent communication is so critical to building trust. So I just wanted to kind of put that comment in there.
Thank you. Amy?
Hi, can you hear me? Can you hear me?
Yes.
Okay. I feel as though trust can be re-earned. I think that that would be the word, if that is a word. But if it's mutual, I think that mutual trust is going to be, the absolute end goal of everything that's been going on, of the listening sessions, of any communications that have gone out. um I know that there have been a lot of discussions going on about, the overspending within Maryland Disability Services, and there's a very strong notion that a majority of the overspending and of going over the budget was in self-directed services, um, even though we have evidence of the opposite happening, which and there's also notions and stigmas about family as staff, taking advantage of people, which none of us can say, none of us will say that that never happens, absolutely never happens, because we can't speak for every single person, but that is not what is going on in the majority, in the vast majority of self-directed services, of teams. There's, a lot of intimate tasks going on, whether someone needs help with bathing or with using the bathroom, um, a lot of things like that where, the person genuinely would just feel more comfortable with their family providing those services. There's also, just a lot of, I think,
Thank you, Mimi. Any last comments? For DDA has heard that the amount of information being shared can sometimes feel overwhelming. What are more effective ways we could share information so that it's clear, concise, and easier to digest? Jessica?
Hi, thank you. Sorry. So I just wanted to take a moment to kind of project to you guys. My sister, who's a participant and is nonverbal, sitting here with me, and she very much appreciated the last commenter's concern. She's raising her arm and waving and letting you guys know that she agreed. And so, to that effect, I feel like sometimes. I believe that actions speak louder than words. So when participants start feeling fully supported and less stressed and less anxious, I think it will become clear in their minds that they can trust the DDA and the programs that they have because they're working. So I think when we start seeing the consequences and the actions on the ground, that will become clear and concise to all of us. So just a different perspective. I know my sister knows that she can trust that I'll show up every day. Um,
Thank you, Jessica. What's your sister's name?
Her name's Jennifer, and she's
Thank you,
listening to all
Jennifer.
of you. Yes. So, and she enjoys listening to some of you guys and hear the good things. And she can definitely agree with some of the things that are being commented on.
Thank you, Jessica and Jennifer.
See, Jen?
So at the end of the day, we want our loved ones to live the life they want. Family members that care, providers who can help if they have to go that route. But at the end of the day, we appreciate DDA. We appreciate the time that's taken out today. But we want them to live the life that they want. And who knows best? We know best, family and staff. So thank you.
Thank you, Ms. Jones.
I think it's on there. I know we're not going to get any answers today, and I understand that. I'm going to come back to, because this is something that really affects us, is with the guardianship and the substituted judgment form that they're talking about. And I know one of the reasons they were putting that out was because they're saying there's a conflict of interest. And I don't see how that, I think that just falls hollow because we, there's no conflict of interest when you have a support broker who oversees his budget and a CCS that oversees his budget. So the decision is made basically as a team when we make decisions for him. So I just think there has to be some way that the state can work with the people that have gone through the courts, that have given us the rights to make decisions for our children. Again, we are the best ones to make those decisions. And I know there's probably cases where I guess the old saying is one bad apple ruins the basket. But for the majority, people are making decisions for their child because that is the most important thing for them. So I don't see how the substituted judge, and again, we haven't seen it because it's not been put out. And we were told October 6th, all this stuff would be put out, but here we are and it's not out. So it's just something that we need to have so we can see it and
Th-
understand it. Thank you.
Thank you. Thank you. Any additional comments? Mhm. Say thank you. As DDA continues to focus on accessibility, equity, and long-term sustainability, what solution-oriented ideas or recommendations would you suggest for us to consider? Jessica, I saw your hand.
Hi, thank you. So there's so much to consider for long-term sustainability, but I'm just wondering if we can maybe, as a suggestion, take a good look at the fee-for-service system and see exactly how that impacts the overall budgets within DDA. I suspect that it's relatively difficult to do from our positions, but at the administrative level, that's maybe something worth analyzing, because then you can kind of trickle that down into your rates and then into the structure design of these programs.
Thank you. Mimi?
Hi. I think as far as helping people to understand, I think someone mentioned it before, a few people have mentioned along the lines, but ensuring that materials and resources are available in plain language as well as in multiple languages. Um, there's, again, like I said before in previous sessions, that there is a very large immigrant population in Maryland. There have been a few forms shared in Spanish, but again, Spanish is not the only other language that people speak in Maryland, but also specifically in self-directed services. Um, and ensuring that they are all shared and available prior to implementation.
Thank you, Mimi.
So I've been sitting here debating whether to even mention anything. There was an earlier comment the last time this question came around about having an impact study,
Mhm.
which I thought was a great idea because I think sometimes as we as parents, we think that, you all are sitting, in these offices and you're making decisions or decisions are being made somewhere. And then the information is fed to us and we're all sitting individually in our homes reading this and like, what's going on? Why is this changing? Who's making these changes? And so there's a disconnect. And part of what I was going to bring up or suggest earlier was just question: does DDA employ people with disabilities? Does DDA employ families that have individual good?
Mhm.
Because you can get feedback from those families i- if we do this, how does that look on you? What is that, how is that going to impact you? And that's why when the lady earlier had suggested the impact study, I think would be great because again, just on my, my perspective, I get these emails, I'll get, and of course, I'm sure you all are aware of the Facebook groups. A lot of us are a part of out there, then we're sharing information. And yes, you have to be cautious with that, with what you're getting and reading, but still, it's just like, it's like, why? Why is this happening? Why is this change being made? What is the rationale behind it? Is it just money? Is it, is it coming from the feds? Is it, again, are you all in this room, by yourselves, just saying, well, we got to do something about this line item, or we have to do something about this because this is going to save money, or we see that that's where a lot of the money is going. So we're not getting that rationale necessary. I think all of us, as much as we're also very devoted to our people, I think we're also the reasonable people. I know I try to be in that, okay, I understand what you're, when something here has got to give, there's got to be give on both sides, but it's just, I'm just looking at long term. I like that impact study or just something because again, a lot of times it just feels like these decisions are being made and we get this information and we're sitting there by ourselves in our homes and then, Facebook blows up. Anyway, but thank you
Thank,
all again. This has been great and I appreciate your time.
thank you so much. We really, really do appreciate. We thank you all for being here. We're going to run through the questions one more time because we want to make sure that we have the comments from everyone so that when DDA goes together, as you just said, that everyone's thoughts and comments will be looked at for the external work plan. What's working well?
Something I want to address for those on the line, Marlene Atkinson, Deputy Secretary for the Developmental Disabilities Administration. Something that we should have stated at the beginning of this session is this is the first of many sessions like this. We will continue to go around the state. I think we did mention this in other sessions to continue to support an ongoing feedback loop. So I've heard that common theme as to what DDA is going to do once DDA receives the information, how will the community be kept abreast or apprised or informed of what we're doing. This is the first series of many in the future that will come so that we can keep an ongoing and continuous feedback loop. So we really, really appreciate everybody joining us online and joining us in person today.
Hi, Ivy McIntyre. I just have a suggestion for future sessions. It would be nice to have these questions ahead so we could brainstorm and think about the questions before coming in because it almost feels like you're put on the spot as you've had to go through them multiple times, giving us a chance to think. So if we would have had these questions ahead, it would have been very helpful.
Thank you.
Sure.
Sheets, please. Great suggestion. Thank you. What steps can the DDA take to make its programs and services easier for people to access and navigate? Jessica? Jessica?
I'm so sorry. I don't, you don't have to call me. We're trying to give other people a turn. I just wanted to put a comment on this question about, and I'm not sure how much control you have over this, but I would love to see DDA take some sort of approach to work with other programs or communicate with other programs to figure out if there are ways to bridge the gaps that many families on the ground have to go through. So it's very cumbersome for a family even to like absorb all of the information from DDA, let alone DDA and REM and CFC and Medicare. And it just becomes a real daunting task. There is no uniformity amongst acronyms or even coordinators or supports planners. And it just, if I if I were to write all of this down just for my sister alone, I've got 2 pages of names and contact information. So it is very difficult. And I do think that even designing some of the programs in DDA have not balanced with the designs of other programs well. So the more communication between these other partners, the better. And the more you can communicate with us about what's being said or if it's being acknowledged, that would be helpful.
Thank you very much.
Is there any way, like Deputy Secretary stated, this is the first of many, which is, I commend that. But is there any way you can bring in the PPI, the GTI, I mean PPL, GTI, and fellow when we have these sit-down meetings as well, so we can also, since you're going around the state, to invite them to the forum so we can also ask them question as well.
Thank you, Ms. Jones.
That's just a suggestion.
There's a lot of thumbs up online. God bless you. What actions can DDA take to strengthen and rebuild trust in the community?
Go for it again. I'm sorry to monopolize, but one question is self-directed going to be eliminated? I think that's one of the feelings that I've talked to with multiple participants is they're afraid they're going to lose their services, especially with the rapid cuts and justification of services. Is that a program that's going to be eliminated and force the participants into facilities and or take away the services provided by families?
Thank you. You are also getting several thumbs up in the chat. Was someone else? Jessica? Jessica?
Okay, thank you. That was a powerful question. So for trust, I was just going to touch on, I think that DDA, as a suggestion, should really kind of maybe buckle down or enhance their contract monitoring because it does feel like maybe you guys aren't quite aware, sitting from where you're at, what your contractors are doing that is creating a level of distrust amongst families, particularly with the FMCSs. You know, you say one thing and then the FMCS says something different. They're not well informed, or they don't have their staff advising families or taking actionable steps by either paying things or not paying things that make sense to what you're saying. And from my perspective, it seems very unfortunate that you guys appear to be unaware of the things that the FMCSs are doing, which is making it all very like a super anxious, nervous state. Like, I don't even know if you guys know what they are saying to people or what they're doing or how things are rolling out. So I think strengthening that oversight would really help.
Thank you, Jessica. DDA has heard the amount of information being shared can sometimes feel overwhelming. What are more effective ways we could share information so it's clear, concise, and easier to digest?
So, hey, this is my little mind thinking again. Karina, offices know their people. Okay. The FMS, the financial um, people, they really don't know our families. Piece of paper and say, no, no. There's so much that's been taken out of our regional offices' hands. Now it's handed over to their hands, and there's non-accountability for the FMCSs. I think we need to go back to the regional offices who knows our people, who lives in our communities, that we see in the grocery stores. You know, they see our children. It's just so much that's been displaced from them. And now it's over to the FMCS. And I just feel as though they're overwhelmed. Let's go back. Let's give some of that responsibility back to our regional offices and the four that knows our children.
Thank you. Jacqueline?
Yes, this is Jacqueline Golden. This is not what self-direction was supposed to be. The FMS was not supposed to have that decision making or making comments to how people are supposed to be doing things. I hear constantly from families, they're being told by FMS that they can't do this, they can't do that. And actually they can, and even down to hiring people, they can't even hire people they want because they've hired too many people and the person has left, whatever, for whatever reason. The FMS shouldn't have that control. It's the people that should have this. So it's a big barrier, and it's not going back to the basics of what self-direction was supposed to be. I encourage the state to go back and look what the core values were. These are not it, and I keep saying it over and over, but go back and read it. This isn't it. So please double check what's supposed to happen. Thank you. And we do really appreciate you listening. We really do. Thank you.
Thank you, Jacqueline. Can you define FMCS again, please? Just so that everyone has a clear understanding. Fiscal management accounting services. They were trying to, fiscal management counseling services.
Hi, Ivy McIntyre. As a provider, think I might be in the minority in the room, but also a vendor of self-directed services. I would suggest a more uniform process for both models of service because with us working within both of those systems, it can get very complicated. The processes are completely different for each model, and it would be best if it was more concise and more uniform across the board for both of those.
Thank you. Jessica?
Hi, thank you. So I just wanted to add one more comment. Maybe this falls into this question and a little bit of the sustainability question, but I just wanted to maybe make a suggestion. I did, and it maybe falls into working well. This is the first time that I've ever seen a more widespread understanding of where these dollars come from. I think it would be amazing to some people at the top to realize that many people don't even understand where Medicaid dollars come from. So there's this level of responsibility to make sure we're using them effectively and efficiently. And we have to answer to people. I do understand the concepts of taking care of loved ones, and I love my sister to death, but I'm also very capable of rationalizing and understanding dollar amounts. And I recognize that everybody in my town and everybody in my street and everybody in my state has now contributed to her care. So we have to answer to that. So that care needs to be the right kind of care. So it might be worthwhile for DDA to do maybe some listening sessions for us to hear from them more details about where this money comes from and how we obtain it and what we're supposed to do with it. I do know that now more than ever people are informed about the waiver, which surprisingly many families didn't even understand what that meant. And the cost neutrality portions of this, which directly affect the long-term sustainability, is something that many people, when I've discussed it with them before, didn't understand what that was or that it was a component. And so giving families a more, you know, a, a deep dive understanding of where it all comes from will maybe help motivate the suggestions for program development and infrastructure.
Thank you, Jessica. Jacqueline?
Yes, I just wanted to say I couldn't respond to you before about what FMS meant, or FMCS meant, because my mic was muted, so I was turned off. I didn't want to ignore your question, but you said it was physical management counseling services. That's exactly what it is. I am so sorry I couldn't join in when you asked the question. Sorry.
That's okay. That's okay. Thank you so much.
Mm-hmm.
The last question. Forward-looking solutions, as DDA continues to focus on accessibility, equity, and long-term sustainability, what solution-oriented ideas or recommendations would you suggest for us to consider? Jacqueline? Jacqueline? I was
Sorry.
trying. That's okay. I didn't know if that you were raising your
No,
hand again.
yes, I couldn't, I was talking, but you didn't hear me. I said this before, but involving self-advocates is really vital. I mean, it really, they do such a great job of putting the message across through skits, videos, pictures. They understand their own languages and they can share it with others. So it's really critical. I'm sorry, I don't know if my mic keeps cutting out. It's really critical to involve self-advocates because they can train so many people, and they do
Thank you,
it in the right
Jessica.
way. Thank you.
Thank you. We were able to hear you.
Okay, okay, well, I'm sure if you did. Thank you.
You're welcome. Jessica?
Hi, thanks. So I just wanted to add in here, maybe I know that in the past DDA used to do those lunch and learn type things. I think that maybe it might be worthwhile to do something similar again, and it would be a good way to rope in participants, especially if you were to model it after more or less like a case study type thing. So like you give them a scenario, you give them a participant, and they would be willing to come in and say, okay, well, how the participant could react and say, well, how does that work out in your mind? Like, what does that look like on the ground for you? And then have a coordinator build out a plan or suggest services, do kind of that workout so that people can really get an idea of how different things can be, how flexible they need to be, and how to kind of strengthen that individuality, whether it's self-direction or provider model. And then I would also think maybe suggesting some more output information for families so that they can really feel confident in building the strengths within that family dynamic. I don't think anybody in any part of the state wants anyone to hear that DDA may potentially have the ability to go backwards. You know, we don't want institutions, again, we don't want more institution like places to start developing. This is the direction that everybody agreed was the right direction to be going in. So we don't want to, bankrupt ourselves trying to do it, but we also want to make sure that we're like sharing information the best way that we can. So
Thank
I
you.
thought that might be helpful.
Thank you. Be sincere. Oh, no, go ahead, Ms. Jones.
I just want to piggyback on what Jessica was saying, how everybody has different disability. And I didn't bring this up before, and you probably won't answer me, and that's fine. But awake overnight is a big issue with a lot of families of people that needs the help, where it was in their budget, now it's not. I think that needs to be looked at, and not only looked at, I invite anybody to come to my home and take a day, 2 hours, walk in my shoes to see what I go through every day. But I do it with love and passion, 'cause that's my boo. So um, everyone has a different situation. And I looking at awaken overnight should not be off the table. Should not be when that individual needs it.
Thank you so
Thank you.
much. We really would like to thank everyone who joined us online and who joined us here today. As Deputy Secretary Hutchison said, this is not the last time. We truly thank you for being either online or taking this time out of your busy schedule to drive here to give comments and feedback. And we want you to have a great rest of your day. We really thank you for being here. We will take your suggestions. And again, they're compiling them, so look for additional information. Thank you so much.